Okay, great. Thank you so much for that introduction, Ashley. I really appreciate it. So like Ashley mentioned, my name is Tomiko Yoneda. I usually go by Tiko, and I'm a recent graduate from the Department of Psychology at the University of Victoria. I am currently teaching in the psych department here at UVic and also completing a postdoc position at Northwestern University. I just want to say thank you so much for attending this session. So today I'm going to talk a little bit about normal cognitive aging versus abnormal cognitive aging. And I think that this discussion really highlights the importance of early indicators of cognitive decline, along with the risk factors and protective factors associated with cognitive impairment and dementia. And then that will kind of lead me to a brief discussion of several projects that I have worked on during my time at UVic. So before I talk about dementia and Alzheimer's disease, I really like to talk about kind of normal aging and successful aging. And, you know, everyone is aging. So from the moment we are born, we are aging. And one of my favorite psychologists, Paul Baltes, conceptualized aging as a constant combination of gains and losses. So neither infancy or childhood nor very older adulthood is completely characterized by just gains or just losses. Simply put, in infancy and childhood, aging is characterized by more gains than losses, whereas in older adulthood is kind of characterized by more losses than gains, but there are still gains in older adulthood, and some things just truly do get better with age. So Baltes theorized the SOC model, and this model suggests that successful aging requires three fundamental processes that are essential for successful aging. So selection, optimization, and compensation. And he posits that older adults can age successfully by selecting activities to optimize their ability and compensate for those losses through a variety of methods. And a really classic example of the SOC model is that of Arthur Rubinstein. And so Arthur Rubinstein was a classic pianist who played in public for 8 decades, which is just kind of mind-boggling in some ways. So as he got older, he had to deal with the physiological age-related changes, so kind of slowing in his hands and his fingers, as well as the cognitive age-related changes. And he continued to perform successfully, so to age successfully by playing fewer compositions, and this is this idea of selection, by practicing that kind of smaller number of compositions in more depth, so that's optimization, and then by adjusting the relative tempo to minimize losses in keying latency, and that's compensation. So, you know, many people do this naturally. So SOC can be this implicit process that occurs naturally while you're aging. But you could also explicitly engage in selective optimization and compensation. So you can think about the tasks, skills, and experiences that are most important to you and make a plan for how to compensate for those age-related losses, which then can optimize those experiences and skills. Kind of just thinking back to cognitive aging. So normal cognitive aging is characteristic of successful aging. But what is normal and what is abnormal? So Jody kind of covered this in her presentation just before, but like forgetting where you put your keys or your glasses, that's normal. Forgetting a birthday or an anniversary, also normal. Struggling to find the perfect word, also normal. So these are all things that many of us do throughout our lives, and it's not unusual to continue to forget some things in older adulthood or to become a bit more forgetful than we were relative to earlier in our lives. What we should be more concerned about is kind of difficulties with concentrating, planning, problem solving, or organizing that, and this is a really important part, that are impacting daily functioning. So perhaps struggling to even conceptualize what happened when you last had your keys or what you usually do when you come into the house. This is when it might be time to kind of check in with a doctor. So although some memory loss and kind of a general slowing is normal in aging, dementia is not a normal part of aging. And dementia is the umbrella term for all neurodegenerative diseases. So that is any disorder that progressively impacts the brain in negative ways. And vascular dementia, Parkinson's disease, Huntington's disease, frontotemporal dementia, and many others are all kind of different types of dementia. However, Alzheimer's disease is the most common type of dementia, and this is why these words are sometimes used interchangeably. And statisticians from the World Health Organization estimate that given population aging trends, the number of individuals living with dementia will triple by the year 2050, and eventually that number will surpass 100 million cases worldwide. And this means for Canadians that in the next few decades, almost everyone will be personally affected by dementia, either through a personal diagnosis or a family member's diagnosis. And although there is not yet a cure for Alzheimer's disease, there is still hope. So there is a lot of research showing that the progression of dementia can be slowed by adherence to a healthy lifestyle. So this has been termed cognitive reserve in some fields and represents the ability to withstand neuropathology that's characteristic of Alzheimer's disease. So in this figure, you can see kind of that average trajectory of cognitive functioning may look like this bottom one here. But if individuals are really healthy, so if they're eating well and if they're physically, socially, and cognitively active, their trajectory may look more like this top one here. So you can see the person with more cognitive reserve starts higher on memory tests and doesn't decline until closer to death. So while the end date might be the same, so death, the path to get there might be experienced very differently. And I'm sure that you can imagine that quality of life and happiness would be experienced very differently as well. Okay, so because research really suggests that progression of dementia can be slowed, those risk factors for cognitive decline and dementia from across the lifespan are imperative. And likewise, the early indicators are also really crucial. So risk and protective factors are pretty obvious, but when I say early indicators, I mean characteristics or symptoms of the disease that can be identified before individuals progress to a state of substantial cognitive decline. And kind of in both cases, individuals have this opportunity to make a difference to their own future because they can be educated and ideally motivated to make changes that will contribute to their own health and cognitive functioning. So in other words, engage in the protective factors. And this is really the motivation for my research. And I'm going to tell you about a little bit about some of the projects that I've been working on during my time at UVic. So this first one is looking at personality. So quite a bit of research suggests that certain personality traits are associated with an increased or decreased risk of dementia. For example, individuals living with dementia tend to be high in neuroticism. But this really kind of begs the question, are individuals high in neuroticism more likely to get dementia, or do individuals with dementia increase in neuroticism? And as it turns out, research suggests both. But the timing of when neuroticism actually tends to increase was unclear. And so kind of based on some previous literature, I wondered if neuroticism may increase prior to a dementia diagnosis. And I analyzed data from these 3 studies independently and found that in every study, individuals who were eventually diagnosed with dementia showed similar patterns of personality change preceding their diagnosis. Further, there was a similar pattern of that personality change, of those increases in neuroticism in the individuals who were eventually diagnosed with mild cognitive impairment. Conversely, the individuals who didn't have a dementia diagnosis or an MCI diagnosis showed stability in personality over time. So overall, this was based on more than 2,500 participants, and I replicated these results in 3 longitudinal studies of aging, and taken together, these results suggest that the changes in personality may be an early indicator of a looming dementia or MCI diagnosis. I'm also working on research with another one of my lab mates, Jamie Knight, using smell testing. So I'm not going to talk about this too much because Jamie is actually presenting on this tomorrow. But if you're interested, I would recommend attending her talk. She's a great presenter and her research is really fascinating. But we have submitted a paper examining olfactory impairment and risk of mild cognitive impairment, dementia, and death to neurology clinical practice. And briefly, our results suggest that olfactory ability, and in particular the declines in the ability to smell, are a really robust early indicator of cognitive impairment and dementia. Okay, so this was my dissertation research, and I focused on blood pressure and blood pressure variability. So it is well accepted that both high blood pressure and low blood pressure are associated with cognitive decline and dementia. That is, they're risk factors for dementia and cognitive decline. But more recently, research is showing that it actually may be variability in blood pressure that is a more telling risk factor for cognitive decline and dementia. So some variability in response to the context or to physical exertion is adaptive, of course, but if you're sitting at rest for at least 5 minutes and if you tend to show like really substantial increases and decreases in your blood pressure relative to your average resting blood pressure, that is likely putting individuals at a heightened risk for cognitive decline due to the kind of inconsistent perfusion and blood circulation in the brain. So for my dissertation research, I measured blood pressure and cognition in individuals twice per day for several days in a row to investigate if changes in blood pressure were related to changes in cognition at the daily level. And findings suggested that individuals with more blood pressure variability on average performed less well on some of the cognitive tasks, but the investigation also revealed some evidence for a within-person association between blood pressure and cognition. So let me explain that a little bit more. So as you can see in this figure, there's quite a bit of variation in blood pressure over the 2 weeks. Here, each trajectory indicates a single person, where each of these little dots is a blood pressure recording. So I separated out this one individual here. It might be small on your screen, but basically you can see that there's more clearly like this fluctuating blood pressure over the 2-week protocol. And you can see that their systolic blood pressure is ranging from approximately 105 to 155 over that time span. And there is a similar amount of variability in performance on the cognitive tasks from occasion to occasion. And my analyses suggested that this isn't just kind of random variability. So on the occasions when individuals had higher blood pressure compared to their personal average, they performed less well on some of the cognitive tasks. And that was adjusting for physical activity and stressors. So I think this is a meaningful avenue for potential outcomes because blood pressure can be controlled through lifestyle changes and also through medication. Okay, so finally, a little bit of work on some protective factors. You might wonder what contributes to being kind of on that upper trajectory. So all of these kind of protective factors can, and I just realized that I have the wrong title here, but please ignore that. The majority of research in this area really kind of highlights the benefits of education in young and middle adulthood and cognitive engagement in like middle and older adulthood. But I'm working with a lab member, Nathan Lewis, who he's actually here with us right now. And we examined the impact of the number of books that people have in their homes during childhood. And our findings are showing that having more access to cognitive resources in childhood measured by the number of books in the home is associated with an increased ability to withstand the symptoms of cognitive decline and dementia. And these findings suggest that cognitive reserve is something that can be modified throughout the lifespan. So it's not just kind of like a middle and older adult phenomenon. And Cynthia, I see that your hand is up. I'm just kind of want to rush through my last slides. Do you mind if I continue going until I finish this? And then I'll take questions if there's time or wait till the end. hopefully that's okay with Cynthia. Okay, so
sorry, you have about 5 minutes left.
Okay. Yeah.
We'll get to questions.
Okay, thanks, Ashley. Okay, so this was some of our lab's research looking at sleep health and how sleep health is a protective factor. So sleep patterns and circadian rhythms change with age, and sleep complaints are common with older adults. So it often takes longer to actually fall asleep, and older adults tend to report prolonged awakening at night and just kind of this overall feeling of not sleeping well. And the majority of research in this area examines between person differences in sleep and cognition. So that is individuals who get more sleep on average perform better on cognitive tasks compared to individuals who get less sleep. So this was actually research that I supervised of an undergrad who's now doing her master's at UBC. And again, we examined those within person associations between sleep and cognition. And this is quite intuitive, but we found that at that within person level, on nights when individuals got more rapid eye movement sleep minutes compared to their personal average, they performed better on some of the cognitive tasks the next day. So this really just suggests the importance of sleep health and probably a bit of advice that I should be taking myself. Finally, speaking of kind of sleep issues, a really excellent approach for improving sleep health is by engaging in regular physical activity. So beyond contributing to sleep health, a substantial body of research suggests that physical activity protects against cognitive decline. Kind of the underlying, in terms of underlying mechanisms, the idea is that it can increase neuroplasticity. For example, some research suggests that physical activity actually increases hippocampal volume, which is pretty incredible. But in this study, this project that I worked on, we examined the likelihood of transitioning from non-impaired cognitive functioning to mild cognitive impairment and also dementia and death. And so I coordinated these analyses across 14 longitudinal studies of aging, and that included over 52,000 participants from North America and Europe. And the results suggested that more physical activity is associated with a significantly reduced risk of transitioning from this non-impaired state to a mild cognitive impairment and also to death, so less likely to kind of make those transitions there. There's also some evidence that more physical activity was also protective for kind of like increase the likelihood of moving backwards through the states as well. So basically that physical activity is protective even after an individual starts showing symptoms of cognitive decline. We also estimated life expectancy, and results suggested—
Tiko, sorry to interrupt, but you have 2 minutes left.
Okay, thank you. And the results suggest that approximately so for example, here you can see there's approximately 4 additional years of life expectancy for a 70-year-old male if you engage in approximately 150 minutes of physical activity per week. And 150 minutes, so that could be 3 50-minute sessions. So really overall, these results suggest that physical activity is protective against cognitive impairment and death, and it's also kind of controlling for competing risk factors such as death. Finally, because these results felt quite important to share with the general public, I worked with a friend of mine who's a graphic designer with Design Coast to create this infographic summarizing the results. So this was actually included in this publication as a figure, and we encouraged health professionals and aging centers to print the figure, so with the poster, and post it in their offices or gyms or center on aging. And the poster is also up in Alzheimer's Society offices. Okay, so that was a lot of information to cover in 20 minutes, but really there are many other early indicators, risk factors, and protective factors of cognitive decline and dementia. And I really kind of just focused on what I've studied personally over the last 7 years. But if you're interested in anything I spoke about, or if you're interested in more, please do get in touch. My email is tiko@uvic.ca. And in closing, I just wanted to say thank you so much to my collaborators and the funding agencies that supported this research, and also the participants from our community who have volunteered and really made this research possible. And for all of you for your interest in this research.